Hi guys, welcome back to my YouTube channel. My name is Dr. Rosna, and I just want to let you know a happy news that I cleared my AMC Clinical Examination last month, and I was just thinking about putting few videos on AMC Clinical Examination too, because a lot of you were asking, and I thought my videos could help you better rather than me directly telling you about it. So I'll just be making few more videos. Like in this video, I'll just be talking about how this examination is done and what things you basically need to know as when you start preparing for your AMC clinical examination. But in the videos and thenceforth, I will be talking more about the technological requirements that is needed, some software requirements that is essential part, especially if you're doing the online examination. And I'll also make another video about how I prepared my examination and so basically, it's not tips or tricks, but I'll just tell you what I did to clear my examination in the first attempt. I'll just be making these videos in different parts so that it'll be easier for you to view them. And as always, guys, please do let me know if you have any comments or doubts in the comment section, and also how I can improve my videos better. And if you like them, please do share that with me too. Welcome back, guys. So today we'll be discussing mainly about the introduction of AMC Clinical, some basic ideas, and please do subscribe for more videos about the same. Okay, let's get started. So as I mentioned, this is just the introduction. We'll be learning how this exam is done, what this exam is all about, what you need to, emphasize when you study for this examination. So it's just an overview that I'm going to give you, and we'll get into details in the following videos. As you guys might already know, I did make a video about AMC MCQ examination or the part 1 examination. Once you've cleared your AMC MCQ examination, that's when actually you become eligible to do your clinical examination in the portal that we've already discussed about the AMC portal and stuff. So over there, it'll be mentioned that your status of your examination will be mentioned as you are eligible for your clinical examination, and that's when you book your dates and you start preparing for your AMC clinical examination. So there are a few people who get jobs after AMC 1, guys, but a lot of you were asking me, but it's quite difficult for you to secure a position after AMC 1, especially if you are overseas and if you do not have much experience and a very great portfolio or a CV. It might be difficult for you to secure a position, guys. So what I would say is, even if you secure a position, you are on limited registration. You still have to do your clinical examination. Right. So clinical examination is something that you need to do. Another pathway that you have is a work-based assessment or the WBA program that kind of avoids your clinical examination pathway, but it's very, very difficult for you to get into the work-based assessment, right? So I would really recommend you guys to sit your clinical examination, clear them, be eligible for your provisional registration, start applying for your jobs, right? Rather than prolonging your clinical examination, further and further. So the eligibility for your clinical examination is having passed your AMC MCQ examination. Now, a few general things about the AMC clinical examination. So the clinical examination, it consists of 20 stations, right? So it's just like the OSCE examination that you might have done in your final year when the bell rings and you move from station to station running around the hall, right? So it's something like that. It's just that you're not moving around. You'll be sitting in front of your computer and they will change you from one screen to another, put you into different screens, right? So that's how this examination is conducted. So you basically have 20 stations, right? And of which there are 16 stations that are assessed, and there are 4 rest stations. So when you put into the rest station, you have that 10 minutes simply to sit back and relax. If you want, you can take a bathroom break at that time, but it's just that you have to be back within 5 minutes. So I'll just make a detailed video about how this examination would be on the day of your examination. I will do that soon. So basically you have 20 stations, of which 16 stations are assessed. Now, of this 16 stations that are assessed, you have only 14 questions that are scored, and there are 2 questions that are non-scored, or meaning it's pilot questions. So although 16 questions are assessed, 2 of the questions are not scored. So your mark or your final, whether you pass or not, it's out of 14, right? So that's the 20 questions that you have, the 20 stations, 16 assessed and 4 rest stations, of which 14 are scored, 2 are non-scored or pilot questions. Now, as I mentioned, you will be rotated from one station to another during your examination. Now, with the format of the examination, guys, you have 10 minutes, okay? You have 2 minutes reading time and no taking notes during your reading time. To be honest, reading time is when you have a lot of points in your mind and you literally want to write everything down to, because when you start talking, you might forget whatever you thought during your reading time. That happens, guys, but AMC does not allow you to write that down on your paper in your reading time. No pen, no paper to be touched during your reading time, right? And after the 2 minutes reading time, a prompt will come. They'll say the station can now be begun, and you will start your station. And the 8 minutes would be your assessment time. So that's when you talk to your patient, you describe your physical examination, you take history, or whatever your task is. You are going to do that in the 8 minutes time. But again, unfortunately, there is no timer that is running on your screen. You will not know how much time it's been since you started your examination. So um, the idea is, guys, whatever key points that you have for that particular case, make sure you complete all the key points that is required for you to pass the case, right? So even if you run out of time, now that you've completed all the key points, you will pass your examination. Although there are a few other points which are not as critical as the points you've already covered, right? So that's the importance of key points, about which again I will talk more in a more better way in my upcoming videos. But make sure, because you have 8 minutes time only to talk about a lot of things that you really want to convey to your patients, and you do not have a timer, you will not know, you cannot keep a pace of the time, as well as think of what points to talk about, as well as talk to the patient. See, all these things cannot be done together, so you might lose track of time. So that's why I said key points first, and then whatever time that you have left, talk whatever extra points that you have. Now, so that's why I did write down that it's all about your brain. It's all about, preparing. While you're preparing for AMC Clinical, write down things in your brain rather than writing them down on your paper, because pen and paper, although it can be used during your, assessment time. See, guys, when you're talking to your patient, and you just have 8 minutes to cover a lot of key points, you cannot write down or make note of all the key points on your paper. So it's about writing down the key points in your brain during your reading time. So that's why, guys, it's all about your brain, and I want you to train your brain in such a way that you can write down all the key points in your brain and think them and talk about them rather than write them and read them out, right? So the way of preparing for this examination will be a little bit different from how we might have prepared for previous examinations. So guys, I did mention that of the 20 questions that you have, 16 are scored only, sorry, 16 are assessed, only 14 questions are scored, right? So the rest of the 2 questions are assessed, but they are not scored stations, right? So we call that a pilot question. So, so a pilot station serves as a trial or a test run to evaluate the students' instructions, materials, and the overall process. The pilot station help identify any issues, gather feedback, and also make necessary adjustments before incorporating them into the main clinical examination. So these are the same lines that I took from their AMC website. So basically, pilot questions are some new questions that they introduce into the system. Just so it's like a trial run that they are giving for these questions to see how well you're doing this particular question. If they find that a majority of the students are responding to this question in a really good way, after a few months, they can put this pilot question into the scored pool of questions, right? So it's just a trial run that they use. So always you might have 2 questions that would be in a trial run that are, assessed but not scored. Now, these pilot stations, they have been developed by a discipline writing group, and they will be approved by the clinical assessment panel for the pilot status. Now, these pilot questions, they have no statistics from previous examinations. It'll mostly be a very new question, and there have been people who, situations like questions are like totally out of blue. They'll be like questions that have never repeated, questions sometimes that are totally unfamiliar for you. So that is why there will not be any statistics of these pilot questions from your previous examination. Sometimes it could be a recurring question, but although it's reintroduced as a pilot question just to see or just to make analysis of how well the students are performing it now when compared to before. Okay, so pilot stations are also may also be stations requiring a trialing for administrating purposes, including stations with special operational and technological requirements. So that's why told you, like sometimes questions that were introduced in the past can come up again, is again becoming a pilot question. So that's again to trial and check if these questions can still be administered and still be put into the scored pool or not. So remember, guys, that you will always have two pilot questions, and these questions are not scored. So the thing is, when you get a question and if you're not able to do them properly, just pray to God for that question to be pilot question so that it won't be, assessed or scored. It will be assessed, but obviously not scored. Okay, so about the passing requirement, guys. So the overall examination results, whether you pass the exam or you fail the examination, this will be determined mainly by your 14 scored stations. So, like as I mentioned, the 16 stations that you are going to do, where you're going to talk to your patients, that you're going to perform, two questions that are pilot taken out, not assessed. The rest of the 14 stations would be scored, and you need a score of 9 out of 14 to say that you passed your examination, right? You need to pass at least 9 stations to clear your examination. So if I remember it right, up till May 2024, I think it's May or June. So until that particular date, it was 10 out of 14 that you needed to pass, but they decreased the requirement. You need only 9 to pass your examination now, because you guys know how difficult this examination is, so they didn't want to make it even more difficult. So that's why they reduced that one score. Usually, the scored stations will not include either of the two pilot stations, as I already told you. But if there is an issue with one or two of the non-pilot stations, or those stations that are scored, these 14 scored stations, if there occurs any issue with one of those stations, AMC might decide to score those pilot questions, score you for those pilot questions that you did, right? So that's what they are telling in this particular line. But if there's an issue with one or two of the non-pilot stations, the clinical result panel may determine that one or both of the pilot stations be substituted, right? So if this occurs, the candidate result will still be determined on the basis of the 14 stations that they did, but because of some issue that happened with the scored station, they might have to, include one of the pilot station into it to um, make it out of the 14 questions that you need for the examination, right? So that's why they basically do the pilot examination. Again, another reason why they take pilot questions. Now, just like how we had few set of topics that we need to learn for the AMC MCQ examination, AMC Clinical Examination also has few topics that you need to learn. It's just the same, but a little bit different. Like you have medicine, you have surgery, you have orthopedics of all ages, including pediatric age orthopedic cases will be there. You have obstetric cases, you have gynecology cases, you do have pediatric cases, and all age mental health cases will also be there, or rather the psychiatry questions for all ages, like including pediatric conditions. There are cases of ADHD, autism cases are also there. It's like similar to your AMC MCQ examination. I think it's just that there is no biostatistics and population health questions and ethics questions, but otherwise all of the topics that we studied for our final year examination, they're all there for the AMC MCQ examination also, because they are basically checking if you are equivalent to Australian medical graduate, right? So it's just the same topics that you are learning and reading again, but the way in which you are learning them would be different because now it's a clinical examination. So, guys, there are some predominant assessment area for each question, right? So you might get some questions where you have to take the history, form a diagnosis, form the differentials, and talk to the patient. So that's basically the diagnostic formulation, how you are coming to a diagnosis by taking the history. So you need to take a very proper history, making sure you're ruling out multiple differentials to, formulate your diagnosis. So that's basically diagnostic formulation. There are some questions where, your predominant assessment area, or the area where you will be assessed in detail, would be the diagnostic formulation. So there, they're mainly looking how you formulated your diagnosis. That is your predominant assessment area, not how well you took the history, although they do consider other predominant assessment area also. So it's in a nutshell, like it's a whole, it's an entire thing that you need to do. They do check how well you did the history taking, how well you communicate with the patient, how well you responded to their queries. They do look all of them, but there is a predominant assessment area that you need to do pretty well in order to pass your examination. So these are some of the predominant assessment area that can be there in your examination question. Either it could be history taking. So in history taking cases, they will be mainly focusing how well you are taking the history, right, and formulating your diagnosis. They will not be looking how well you did the physical examination in that case, right? But there are particularly questions for physical examination where the predominant assessment area is just physical examination. You might be asked to take the history also, which you need to do in a very good manner, but the examination part, the physical examination part, will be the key area, the key assessment area, and that is what you need to be, you need to complete in the perfect manner in order to pass the examination. So when I tell about predominant assessment area, see guys, it's not like this is the only assessment area or the only area that you will be scored for. No, I will show you the scoring chart of AMC also in my another video. So it's not that they are going to look only at this particular predominant assessment area. They will look how well you took the history. They will look how well you were able to formulate your diagnosis, how well you're communicating with the patients. They will look all these assessment areas. But this one predominant assessment area, or that one key thing that you were asked to do in your examination, in your station, that would be having a little more weightage than the other predominant assessment area. So that's what I mean with the predominant assessment area, right? So you can have questions where you have to take the history, you can have questions where you need to do examination, diagnostic formulation, like I already told you about. Sometimes you'll be asked to take the history and talk about the management or counsel the patient as to what can be further done, or give them some education about their condition. So these are the areas that you will be assessed. So whenever you are learning a particular topics, you need to learn how to take a good history. You need to learn all the differential diagnosis so that you can incorporate all the questions that you need to ask in your history to formulate your diagnosis. So that's your diagnostic formulation. You need to learn how to do key physical examinations. You need to also learn few management and few questions where you have to counsel the patient about the treatment options that they have and about their vaccinations or maybe other counseling that they need, that you need to give them for a few blood tests or treatment and so on. So these are basically the four predominant assessment areas. So guys, this is just an overview that I'm giving you. I will make videos in detail about all of this, so that'll help you do your examination pretty well. Okay, so these are some of the type of cases that you will commonly come across when you start preparing for your AMC clinical examination. You can have history taking cases. You can have cases where for 8 minutes you will be completely counseling the patient. Like, for example, you can have a cervical screening test counseling where you'll be counseling the lady about what the tests are, how the test would be done, and what alternative options that you'll be having. Sometimes you'll be asked to counsel the mother regarding some vaccination for her child. Sometimes you'll be asked to counsel about a treatment plan for that patient. So for 8 minutes, you'll be purely counseling them. Another type of case is physical examination, where you will have to explain the entire steps of physical examination to either the medical student or to the patient, either directly or through in a teleconsultation scenario, right? So the thing is, guys, in these questions, in these different type of questions, as I already told you about the predominant assessment area, you will be having a predominant assessment area in these questions, right? For history taking cases, sometimes it will be like 5+3. What I meant is 5 minutes for history taking and 3 minutes to talk about the diagnosis and the differentials, or 6 minutes to take the history, 2 minutes to talk about the diagnosis and differentials. So 7 minutes for the history and 1 minute. Sometimes they might be just asking you to describe the diagnosis and not the differentials. So depending upon what time you have, they'll give you a prompt time. Like if it's a 5+3, like 5 minutes for history, 3 minutes to take the talk about the differentials and the diagnosis, you will be given a prompt time at 5 minutes. For example, after 5 minutes, while you're taking the history, you will get a prompt time where they'll say like, this is your prompt time. At that time, you'll have to start talking about the differentials and the diagnosis. Similarly, for 6 minutes, you can get a prompt time. For 7 minutes, you can get a prompt time. So that's how history taking cases usually goes. And make sure that if you have a 5 minute prompt time, guys, think in your mind, okay, now I have got 3 minutes, right? So I have time to talk about a lot of differentials. I have time to deeply explain my diagnosis, right? But if you have a 7+1 type of case, like 7 minutes for history, 1 minute for diagnosis, guys, you just have 1 minute for explaining the diagnosis and maybe even pumping in few differentials into it for closing your case in a most best manner. So in that case, you have to be very vigilant, because in that 1 minute you have to be pretty fast, talk in such a way that you do make the patient understand what the diagnosis is, explain the diagnosis, as well as incorporate few differentials into it, right? So be very vigilant about what time is left for you, and be pretty fast or detailing your differentials and diagnosis depending upon how much time that you have left. right? So in history taking cases, mostly predominant assessment area can be either diagnostic formulation or checking the history taking per se. It can also be management or counseling. Sometimes questions will be like 5 minutes for history and 3 minutes for talking about the treatment options or treatment plans that you have for that patient. So the predominant assessment area keeps changing. Like if you are having a history question, that doesn't mean the predominant area assessment area for that question is always history taking. It can be history taking, it can be diagnostic formulation for that case. It can even be management of that case that comes out as a predominant assessment area. So that's why, guys, when you study the case, it's not studying the case to, completely do the predominant assessment area alone. They will be focusing you in an overall manner. It's not just the predominant assessment area that they're looking. Even if you score really good marks for your predominant assessment area, if you score really bad in the one other assessment area, your overall marks can be affected, right? So that's why, guys, all those predominant assessment areas should be given equal importance, although there will be one predominant area which will be a slightly weighted more than the others. But it's just that, guys, when you're studying, be perfect in all the assessment areas. Do not give any particular importance to one area. You need to know everything completely because, guys, those are your patients. You need to take care of them in the best possible way, right? So that's about the history taking cases. And for the 8 minute counseling cases, it's like complete 8 minutes. You're just going to talk to them about the counseling process, like, about vaccination or cervical screening tests and so on. Physical examination, guys, physical examination stations are mainly to your medical student, or it could be to your patients. It could be directly to your patients, or it could be teleconsultation cases. So the idea with physical examination here is a little bit different. So back in your offline examination, you could really do the physical examination to your patient. The examiners could check you, ask you questions, and they could score you. But with online examination, guys, you are not doing your physical examination. So that's why it's a little bit more tricky. They've made it really difficult. They really do check every aspects to make sure that you are capable of doing a perfect physical examination to make a diagnosis. So that's why in that 8 minutes time, which is not a, it is pretty less amount of time that you have, that you need to talk about the physical examination in great detail also. So the idea here is AMC, they thought if I make the students to, I mean, the examinees like us, if we are to talk to the examiners about the physical examination that I'm going to do, say, for example, for a patient with sensory neuropathy, if I'm to do a sensory neuro examination to my examiner, obviously I know that my examiner knows every medical terms, and I'm going to, complete it really fast in without properly explaining it, right? Because my examiner knows everything. Why should I explain it more, in a detailed manner, right? So, but if the AMC examiners put the physical examination in such a way that you need to explain it to a patient, it's going to give you a really hard job. Although we do have questions like that for our examination, that'll be really difficult because you will have to put out all the medical jargons, and you'll have to make it in the best simplified manner for the patient to understand, especially in telehealth consultation, guys. So these are where you're going to ask your patients to do the examinations that you should be otherwise doing. So it's very difficult for you to make your patient understand those steps and processes that you need to do, um, and make them understand those steps to make them do and give you a result out of it. It's pretty difficult. For example, in my case, in my examination, I had an ankle telehealth case. So to make my patient do the complete ankle examination, it's very difficult, right? So that's why AMC decided to use a medical student, right? So a medical student is like in between. They don't know as much as the examiner, and they're not, they're not having a very less knowledge like the patient, right? So you can use a bit of medical jargon, a bit of explanation, and you can cover up a physical examination 8 minutes too. That's why in most of your cases, physical examination stations, it is the medical student who will be there. Although sometimes you can be unfortunate to get some telehealth consultation case also. In my examination, as I mentioned, I had ankle telehealth. But the idea here is it's not about making your patient do it. It's about how well you are able to explain it in a way that your patient could be understanding it. So your examiners will be mainly looking the overall construction of examination that you are explaining to your patient, right? So that's how it's done. So it's pretty easy in my experience. And what I need to tell you is physical examination stations are the most easy cases to pass if you get them. So you need to give a big deal of time to study physical examination cases, because there are a lot of cases. You do have a lot to learn, but if you learn them perfectly, these are the best stations to pass to. Now, have your key points in your mind, guys, because you have no timer. You don't know when you start and how much time you have left. So always make sure you complete your key points first, your critical points first, so that even if you run out of time, all those points that you need to pass your examination would already be given out, right? Now, about the results, guys, you will be getting your results available to download at 4 p.m., 3 weeks following your clinical examination on the Friday, right? So you just can log into your AMC candidate account, and there will be a tab on top where they've written clinical results. It'll just appear on that day. Like if you look at your portal now, you might see MCQ results, but you do not have a separate tab there. I was so confused as to where my clinical examination results might come. But on the day of my examination result, I did see that there was another tab that developed there saying clinical results, and I could see my results there. So, guys, in each station, the examiner is required to determine a global rating for that station. So that's what I said. Although there is a predominant assessment area that they do give a score and they do emphasize on that, the examiners will be assessing you, giving you a global rating. Like they will be checking you in entirety, not just that particular assessment area. And the overall result on each of these stations will be based on the key steps that you're relating to the station. The relevant assessment domain or the predominant assessment area, that will also be assessed. The assessment of the overall performance of the candidate in that station. See, they are assessing your overall performance, your predominant assessment area, your key steps, your key points, and the overall result of the clinical examination is based on the number of individual stations that you passed, right? So whether you passed or not, it's based on how much individual cases you passed. If you passed more than 9 cases out of the 14 stations that are assessed and scored, you cleared your examination. So just an overview for the rate of your examination, guys. We do have only the online examination at the moment. I think it's ongoing for this year. And that costs around 4,391 Australian dollars. Now, in-person examination would be $3,991 from 2025. My understanding is both offline examination will also be conducted. You will have options to do both online and offline examination, guys. Now, if you want to make an appeal, for example, you feel like you did a station pretty well, but you failed for that station, you can appeal. But for one station, you have to give $910. And for additional stations per station, again, you have to give 235 Australian dollars. Now, if you want to reissue your results, again, it's a cost of $107. Guys, it's a play of money. So prepare really well so that you clear up in your first attempt pretty well, and not spending more money on this. Now, as I mentioned, there is another pathway for you guys who have completed AMC 1. You can go for the work-based assessment, but these are available only in very few hospitals and it's very difficult to get in. So it's like a 12-month program that you do with the hospitals where they will be continuously monitoring you, assessing you, and this particular work-based assessment has a fees of 1,070. So if you get in a WBA program, it's pretty good, but I've heard it's really difficult to get in, and there's a very long waiting period for you to get into one. So guys, just a bit of information, like if you want to withdraw from your clinical examination, guys, please do not withdraw. If you've taken a date, please do the examination, because even if you have to withdraw, you'll have to submit a clinical examination withdrawal notification form to the AMC, and the refund of the examination fee are only provided in exceptional cases, and even what is exceptional or not, that is decided by the AMC chief executive examiner or the nominee. What's what's exceptional for you needn't be exceptional for them. So it's very difficult to get back the refund. And even if you're getting the refund, it needn't be the complete 4,000 Australian dollars that you spent for this examination. So what I need to tell you guys is if it's so unavoidable, I mean, if it's not so unavoidable, guys, just do the examination. Do not postpone. I mean, you cannot postpone examination, but do not withdraw yourself from the clinical examination once you've placed your date, because it's very difficult to get a date for clinical examination. And even if you need to withdraw, guys, it's not 100% sure that you're going to get a complete refund of the money that you gave for the examination. To request a refund of application, it must be in writing along with the medical certificate or the statutory declaration, and any refund granted will incur an administrative fee as well. So guys, I just want to tell you that do your examination if you've scheduled your dates. Okay, right. So that was just an overview about AMC Clinical Examination. I do intend to make another video describing about the software requirements and also about how I prepared for my examination, where I'll talk in more details about the stations and how you need to prepare for your examination. So whatever I described in this particular PowerPoint or in my presentation was completely from the Australian Medical Council website. So I just wanted to make it a little more easier for you guys to understand how the clinical examination is conducted. So my reference is this website, and yeah, so that's the end of my today's video. So if you guys have any doubt, or if you need to specifically know about something else, or you want me to make another video about, please do let me know in the comment section so I can come back and help you guys with it. So guys, all the best. So all of you guys have completed your AMC MCQ examination and who are aspiring for AMC Clinical, guys. So do a hard work, and I'm pretty sure you will get through this examination. Bye bye, and please do subscribe for more videos that I'm shortly going to upload. Bye bye, take care.